Hello friends, I'm your host Sharath and we are embarking on a journey onto health, well-being and wellness in our one-of-a-kind show called Health and Healing by Dr. Saraswathi Kalvakota. Optimum health is a vital necessity for happiness, joy and productive life. Our subject matter expert, Dr. Saraswathi Kalvakota, will give us simple solutions and tips to ease around the most elusive and crucial diseases and will throw light onto how to conquer pain, stay fit, and take away home some insights and eye-openers to achieve wellness and well-being. Dr. Saraswathi Kalvakota is a board-certified internist and pediatrician and assistant clinical professor at Wright State University Boonshoft School of Medicine, Dayton, Ohio. She has over 30 years of clinical experience in primary care. Also, American Association of Physicians of Indian Origin, API Life member. She has done a lot of community and social services and promoted health, hygiene, and preventive health services. She is a founder and a proud president of Maitri International Organization in USA, a non-profit registered organization established in 2006, where the underprivileged children and the needy are helped the most. So let's welcome our wonderful guest and subject matter expert, Dr. Saraswathi Kalvakota, to our show. Dr. Saraswathi Kalvakota, welcome to our show called Health and Healing.
Thank you for your kind, eloquent introduction of me, Sharath. And I also want to thank Mana TV International for bringing these important topics in the section of health and healing. And this is a very noble cause and noble way of educating our audience. And they're doing a great service. And I'm happy to join this team and coming out with this health and healing series. So without any further delay, again, I want to thank Sharath for a nice introduction. So I want to now start the topic. So topic for today is on diabetes. So this diabetes is something we all heard about it. It's not a new term. Many people know the word diabetes mellitus. And in short, they call it diabetes. So we really want to know a little bit more about this disease because it causes havoc in our lives. And it is a silent killer. And it also makes a person disabled and causes long-term complications in our body. So we really have the responsibility, or every individual has the responsibility to really know and educate themselves on diabetes. Those who do not have diabetes also need to know. Those who have diabetes is more reason that they should know as much as possible about the disease. So let us start with something, and I want to bring introduction questions and ask Sharath to start asking me questions so that we can walk through systematically from the beginning to the end. So you will have some important messages and the factors to take home. And I will be very happy if you can learn few things from this session. And that's about the beginning for your healthy lifestyle. Okay, Sharath.
So Dr. Saraswathi, thanks for introducing the topic to all the global audience of Mana TV International. A lot of people have a lot of vague ideas, unclear ideas about diabetes, those who are diagnosed and those who have heard about diabetes, and a lot of apprehension around it. And a lot of speculations around diabetes. So fundamentally, I want you to define, what is diabetes so that, you can clear the air for all our audience, and also give us the statistics of diabetes. How is it spreading across the globe at whopping speeds?
Today, the diabetes is the hot topic and most common disease we are all facing in the world, as well as which includes in the United States. So it is important that the diabetes has to be people have to be very well educated with diabetes, because we have diabetes who have already diagnosed. We have diabetes people who do not know that they have diabetes, and the side effects and long-term side effects, all that can cause a big havoc in the person's life, personal life, daily lives too. So diabetes being a silent killer, it is necessary that we need to know what causes diabetes and what is the world statistics and what's the definition of diabetes. Definition is one thing about the sugar we all eat, the food we eat, fat, protein, and carbohydrate. These are the three categories the food we consume. The carbohydrate metabolism is involved with the diabetes. So what we eat, the food is converted finally carbohydrate into glucose. That is going to be, that's going to transport to the cells, tissues and cells in the body. So the cells get energy from this glucose. And for some reason, because of the insulin production, the insulin impairs the transport of the sugar into the cells. So hence, the sugar does not get enough energy. They start having problems with the dehydration, start having problems with the loss of weight, and so many other issues, fatigue, and all those things come. And that's how eventually diagnosis of diabetes is made with certain lab tests. So the definition is there is an impairment of glucose metabolism in the tissues and cells in the body. And there is a production problem in regard to pancreas making insulin. So there is a connection, insulin, glucose, and how the body takes the glucose. So these three areas are a problem. So we end up having the diabetes. So just to give you world statistics of diabetes, we have 1.6 million people have there is a leading cause of death globally is 1.6 million people. And that means what? We look at other diseases, malaria. We are talking about global malaria, tuberculosis, and HIV. And the fourth one is the large 1.6 million. So in other words, if you look at the numbers, 1 in 11 people in the world have diabetes, and 1 in 2 adults have diabetes undiagnosed. And then the global prevalence of this disease is 4.57%, and which was in 1980. Now you look at it, it is 8.5, and that is 2014. And I believe, I'm sure that it has gone up even higher. So 75% with diabetes live in, it's a statistics, it's a finding that they live in low and middle income countries. So the diabetes is not just for Westerners. It is not for rich people. It is for everyone. But the changes which have taken place recently over the last 20 years made a big difference into why it is unfolding more and more. So we talk about it later. And this is the world statistics. And this is a trend in the USA. Now you see the diabetes goes up, total diabetes. And we have diagnosed diabetes out of this total. And some of them are not at all diagnosed, which I just mentioned about. And the next slide talks about its statistics in the USA. Here we have 37.9 million. That means 11.3% of the population is hit by diabetes in this country. And then 1 in 5 out of them don't know that they have diabetes. And it's the 7th leading cause of death in this country. And it's number 1 kidney disease cause. And if you take 100% of the kidney diseases, you can take majority of them have diabetes. So you can see the kidney disease, how it is related to diabetes. Common cause of kidney disease is diabetes. And it's very important that preventing kidney disease means you have to prevent diabetes. That means it has to be under good control. So that is a strong relation they have seen. And again, I just mentioned 90% of this of the diabetes, out of all the diabetic types, which I will be describing in just the next few minutes, 95% of the diabetics types are type 2 diabetics. And out of the 100%, if you take 90% of type 2, in the 10%, we have other types of diabetes. Out of that is a type 1 diabetes, which I will just narrate in a little bit more detail in the next few minutes. So again, there is a correlates of obesity and diabetes. There is a consistent, if you look at 1980, we see continuously rising obesity, and you also see continuously rising diabetes along with that. So there is a direct relationship with obesity and diabetes. So that is about statistics and also about definition. And then now we are going to move on to next question.
What is diabetes, and also unravel the statistics for all of us. Thank you. And I just want to jump into the next question, that is, give us the different types of diabetes.
Let us look at types of diabetes. As I just mentioned, 90% of the cases are type 2 diabetics, but let's not forget other types, because they are very important and they also have a serious sequelae. And if they are not diagnosed on time, that can also cause a lot of morbidity as well as death. So it is very critical that we all know some of the other types. You do not have to know a whole lot, but at least you know that this can happen to this particular group of patients. So what are they? After type 2 diabetes, what we have is type 1 diabetes. Type 1 diabetes is where the pancreas totally cannot make any insulin. That means zero insulin. And any medications given for diabetes do not work in these patients. Most medications, they work for type 2 adult diabetes. But when the secretion of insulin is zero, none of the medications work. So these people have to have only insulin therapy. That means injections. So that is the difference between type 2 and type 1 diabetes. So let's not make a mistake of treating a type 1 diabetic with oral medications, because we are not going to make this person better. So that's the reason we need to understand. The other thing with type 1 is it can also come in later on too, but though it is rare, it can happen. So it is the doctor's responsibility to find out, are we dealing with type 1 or type 2? We can't put all of them in one group and say type 2 and we are giving and not following the patients. And that is the time we need to have a patient and the doctors work together to see if the patient is responding to the treatment or are we missing something else. Then we need to go after the rare diseases. So what is the type 3 diabetes? This pre-diabetes. Pre-diabetes is like you are not diabetic and you are also not normal. It's like a prelude to something. It's like a phase where your blood sugars and your body is not going, it's deranged a little bit, but nobody can call, doctors cannot call that as diabetic state. At the same time, we cannot call that as normal. So these blood sugar numbers and the parameters for making a diagnosis of diabetes are not there, but they're just about rising from normal numbers. So that is a state, it's called pre-diabetic state. So when we see those patients, when we want to stop them getting diabetes, diabetes by doing certain lifestyle changes. So those people can be benefited a lot because they can prevent diabetes for a long time. So these are called pre-diabetes. What is the other one? Gestational diabetes. Why do we have to know gestational diabetes? It means it's basically diabetes during pregnancy. Patients or mothers who have diabetes during pregnancy can have a lot of problems for themselves during pregnancy, and also infant can go through a lot of problems too. So it is very important mother to be watched to prevent complications of diabetes during pregnancy. And these people, once they have the babies, their diabetes goes away, but later on they tend to have a higher incidence of getting real diabetes. So that's why we need to know the diabetes, gestational diabetes. So these are the 4 categories. Although we talk a lot about type 2 diabetes, let's not forget the other states. We do see them quite common. We do have to address them. We do have to treat them. We want to make them not to have any long-term complications.
So Dr. Saraswathi Kalvakota, now that we know all the types of diabetes, tell us, our Mana TV international audience, please enlighten all of us, what are the risk factors and causes of type 2 diabetes?
And let's move on to the answer you just posed. So what are the risk factors? Very important factors for us to educate ourselves. We just talked about pre-diabetes. So that is number 1 risk factor. So pre-diabetic state can go on for a long time, but beware that that pre-diabetic state can lead to diabetes if we fail to follow our lifestyle appropriately or disciplined way. So that is number 1. Having overweight, that is another risk factor. Risk factor because anytime when you are overweight, the insulin production of the pancreas has to go up to meet the demands of the larger tissues of the organs, larger cell populations, volume. So the higher it has to take care of the energy, produce energy, the insulin has to work hard. The pancreas has to work harder to produce insulin. So that's the reason for people who are obese, the insulin produces maximum, it maxes out, and then it fails to make any more insulin. So that overweight is one other risk factor. And also age. What is that age? Anyone who is 45 and over, we have to be alert, and we have to be, we need to know that diabetes can set in, because in general, the metabolism of our body starts coming down a little bit, and our activity levels, physical activity also, if we are not aware, if we do not discipline with a good physical activity on a daily level, it can also reduce. That means insulin production comes down, and then body becomes resistant to whatever insulin is produced. So then diabetes sets in. So 3 factors, important factors, and they are not anything rare. Age, and your pre-diabetic state, and your overweight. Now, what else? Let's talk about it. If you have a family history, they're called first-degree relatives, your parents, your sisters or brothers. If they have had diabetes, or they are alive and they still have diabetes, you are at a higher risk for developing diabetes. Okay. And mothers or women who had gestational diabetes 10 years ago, now the children are born, grown up and gone, but she is at high risk for developing adult onset type 2 disease. And the infants who are born overweight, because these gestational diabetic mothers give rise to bigger weight babies, 8 pounds, 14 ounces, 9 pounds, 10 pounds. These babies are big babies. Their mothers end up having C-sections. So some of them can still have a vaginal delivery. The higher the weight, birth weight, relates to somehow bigger body, overweight later on. And then these kids tend to have diabetes when they become adults. Okay. Next one, and you come to the ethnicity, they're African American people, Hispanics, and Latino Americans, and American Indians, Alaska Natives. They have a higher incidence of diabetes. And last but not least, it's the most common liver disease, which is called non-alcoholic liver disease. It's not from alcoholism. It is from some other problems. It is a disease of the liver, which causes, we call that as a NASH, N-A-S-H, non-alcoholic steatotic hepatitis. So this causes deposition of fat tissues, and it causes, inflammatory tissues. It causes cirrhosis of the liver. And these people have a higher tendency for diabetes. So look at the diabetes. They can have so many risk factors, and they are not something very rare. You can see day in, day in, day out. Those risk factors are around us. They're all around us, and we live in and out of that risk factors. So it is only that our responsibility to recognize that, oh, I'm gaining weight. I'm 40 pounds overweight from last year. What's happening to me? Am I going to have diabetes? It will get into your mind right away. That means you're associating diabetes with obesity. So you want to take some action. No, action takes to real perspective of changing your lifestyle. So that is the key why we need to be aware of these risk factors. So this non-alcoholic liver disease is something many people do not know what it is. It's a disease comes from the what we call is a fibrosis of the liver, and that itself, there are several reasons for that. And one of the reasons is people who are obese, they tend to have this disease, and that causes diabetes, because the liver is the prime organ where the glucose is stored. Glucose is carbohydrate is metabolized to glucose, and the glucose is metabolized to carbohydrate, glycogen we call it. So liver is not working well. Diabetes gets progressively increasing the signs. So if I want you to take some message from this session, know the risk factors very well. That is the root cause for diabetes. If you can take few of the factors on the points I just mentioned, I think, I'll be very happy that I educated you.
Thank you.
Well enough about diabetes.
Wonderful. So Dr. Saraswathi Kalvakota, thank you so much for your educational facts about the risk factors and causes of diabetes type 2. My audience want to know, those essential warning signs of diabetes type 2.
Okay, that's a very good question, and we are getting there now with this question. Now, before I move on to this question, I'd like you to just go back to the previous explanation I made on risk factors. One thing I did not mention was smoking. Out of all the other factors I mentioned, smoking is also one of the risk factors. Also one of the causes where it can get worse and cause more problems. So do not forget, smoking is also a problem, which compounds the complications of the diabetes too. Now, coming back to this question, warning signs are many, and we can really reduce to few important signs you all ought to know to help yourself, to help your family. So what is happening is our glucose is not going everywhere. It is sitting in our blood circulation. It's not getting into the tissues. Every tissue is suffering from lack of oxygen and lack of functionality. So let us look at what is happening. The urine passes a lot of glucose because it is sitting and it's not getting utilized. So it has to go somewhere, right? So you lose glucose in the urine. So you tend to go to the bathroom a lot, day and night. Daytime, you are drinking lots of fluid. That's called polydipsia. You're eating polyphagia. You're eating like crazy. You're drinking like crazy. You're going to the bathroom like crazy, and you're losing weight crazy, and you are feeling fatigue crazy. So these are all do not make sense, but it's happening. You're eating, you're not gaining weight. You're eating, you don't feel energetic. You're eating, you're drinking a lot. You're dehydrated. You're thirsty all the time. None of them make sense to you. So these are the most important signs, warning signs for you. What are the next thing? At times you feel that your vision becomes blurry and then it comes back. It is because the glucose also sets in your lens and it makes your lens in the eye opaque and then makes it blurry and then it comes back. So this is another sign people notice. And then if blood sugar is going a little bit further high, you start having some confusion, irritability. You don't know, you are kind of become delirious a little bit, and that stays longer. So if that stays longer, that means that you really need attention right away. And that dehydration sets in longer and longer. And at the point comes, you really cannot catch up with the dehydration, no matter how much fluids you drink. So these are the serious warning signs. Initial signs are you're eating, you're drinking, and you're going to the bathroom like anything. These are the weakness and tiredness. These are the things. So when you observe these signs happening, you think about that there is something going wrong, and it is probably sugar related, and you have to get your sugar checked. And that is the biggest thing you can do to yourself. These are the warning signs, and you have to be aware of that.
Wonderful, wonderful. I had some idea about the warning signs, but you have, literally nailed each and every warning sign. If these are the things which are happening, then, it is obvious that it is most likely it is diabetes. You go get your blood test or your blood work and, take the necessary actions. So definitely, next week, I know we will delve more into diagnostics and, how to prevent and how to take proactive steps. So thank you so much, Dr. Saraswathi Kalvakota, for giving us wonderful information about diabetes and diabetes management. Give us, because we're going to come back in part 2 of diabetes and diabetes management. Give us some message, to take away for our Mana TV International audience.
That's wonderful. And I can make it as a synopsis of what we talked about today. And it's kind of, we can recap again next session. We talked today about the diabetes, which is a silent killer and which is a common disease affecting the whole world. And it is becoming almost like 1/3 of the population in any country you take is becoming a diabetic country. And the incidence of diabetes has doubled for that last 20 years. We really need to pay attention to why this is happening. And then we also found out that there are environmental factors, there are genetic factors, and there are so many factors. Personal habits have changed so much in the world that is really making the individuals to be on the obese side, to be on the high BMI side, high weight side. And that has a direct relation to your diabetes. And then we also found out most common type is type 2 diabetes. And we knew today that there is a type 1 diabetes and pre-diabetes and gestational diabetes. And we talked about importance of knowing all those diseases. And then we also talked about risk factors. And most important, we talked about how you should be aware, what brings you suspect, what brings the person to suspect that he may have disease. We talked about the signs, how it presents. So these are all main important factors or points we brought in today. And we are going to continue the topic next session about management, how we are going to test the disease, what is the procedures available, what are the tests available, and how we deal with it. And the one important thing I want you to take home is diabetes can be controllable. It can be treatable. But it cannot be cured completely. So it's like any other, like asthma or somebody who has high blood pressure. They can be kept in control. That is depending on how much you are motivated to do that. It is 50 to 70% is in your control and rest is doctor's control. And having both as a team can help immensely to treat yourself into a healthy state where you can have a good functional life, meaningful life, and with a healthy life. And let's go on to the next session soon, and we will hear more about the diabetes.
Thank you. That was a great message. That was a very proactive message for our audience. It definitely will be an eye-opener for all those who are diagnosed with diabetes and who have a predisposition for diabetes. Thank you so much, Dr. Saraswathi. So friends, now that you have heard everything about diabetes and diabetes management, and also our subject matter expert have given a wonderful message how to harness, and we're also coming up with part 2 of the same diabetes and diabetes management. Until then, please subscribe to our YouTube channel, Mana TV, Facebook page, Mana TV, and also see us live on YUPP TV.